I have a couple of things to cover before we get started. First, if you haven't downloaded a copy of today's presentation and would like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center. Here you will also find a list of our upcoming events. Tom's going to add a link into the chat to get you there quickly if you need to. Our training center also contains a web page for our encore presentations. Videos are available for up to 90 days and can be watched on our webpage without you having to go to YouTube. We know that some of you may not be able to access YouTube from your company computer, and we want you to be able to receive the education that you're interested in. Each encore is posted with the link that will allow you to download a copy of the presentation. You will also be given another chance to complete a survey and provide feedback. Today's presentation is being recorded, and if there are no technical issues, this will be posted to our website soon. Later, there will be a question and answer session if time permits. If you do have questions related to today's topic, please send those in using the chat feature. I did receive some pre-submitted questions, which I will answer at that time. Now, if there are any questions that I don't get to, or if some require some additional research, then an email providing those answers will be sent to everyone who is in attendance today. Our goal is to provide you with an excellent customer experience. We want to know how we're doing, so later in this presentation, you will be given the opportunity to provide feedback on today's event. This is your chance to let us know what we're doing right. Let us know if you feel there are areas where we can improve, and it also allows you to give us input on what types of education you would like to see in the future. Now, while this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you ask for. Now, here at WPS, we do our best to provide you with accurate, up-to-date information. If you've worked in Medicare for you know that Medicare rules and regulations can change. For this reason, the CMS website should be checked for updates, and the federal regulations take priority over anything presented today. We will answer questions based on facts given. Any changes to the information may change the response given. We also are not able to guarantee payment for services. Medicare rules will always determine the final coverage of service, and if you have a claim-specific question, we do ask that you contact customer service. They have the ability to access your claim, and they can provide an answer based on how your claim processed. Lastly, I need to let you know that CMS does prohibit the recording of this webinar. I had said earlier that we are recording it so it can be an encore presentation, so there really would be no need for you to have to do that. Now, today I'm going to provide some general information and some examples of advanced care planning. We're going to go over coverage and billing, and then we're going to finish up with some resources. This is the American Medical Association copyright notice for CPT codes. During this presentation, I will provide billing information that does contain CPT codes. So this notice lets you know that Medicare does not own these codes or their descriptions. This is a copyright notice from the American Hospital Association National Uniform Billing Committee. This notice is required since I discussed coding that would be included on the UB04 or 837I. The American Hospital Association is not responsible for, nor were they involved in the presentation material that is being presented today. So now that we have gotten all of that out of the way, I'm going to start off with a little bit of general information. So I'm providing a couple definitions of things that I'm going to talk about today. Advanced care planning is the voluntary process of making decisions about your future health care in case you become unable to communicate or make decisions for yourself. It involves discussing and documenting preferences for medical treatment, life-sustaining measures, and end-of-life care. An advanced care directive is a legal document where individuals can outline their preferences regarding medical treatment in the event that they become incapacitated and no longer have the ability to make decisions for themselves. Now, if we look at the general population, 33% of adults have completed an advanced care directive, with the majority of these documents being living wills or healthcare power of attorneys. When we look at adults 64 and older, as well as individuals who have been diagnosed with a chronic disease, that number jumps to 45%. Most of these directives are focused on comfort. Some individuals don't want what they would consider extreme measures to be used in order to keep them alive. They may decide that they don't want to be placed on a ventilator or have CPR performed if their heart were to stop. Some choose to focus on pain management or being allowed to pass at home. The National Institute of Health has reported that patients who have participated in advanced care planning have improved quality of care at the end of their life. They are less likely to die in a hospital, and they are more likely to be enrolled in hospice. So what happens if a patient doesn't have an advanced care directive? In cases where a beneficiary is unable to make their own decision and no directive has been put in place, state laws will determine who can make medical decisions on that person's behalf. Now, this usually is a spouse, a parent, or adult children. Now, if the patient is unmarried and has not named their partner as a proxy, it is possible that they could be excluded from the decision-making process. In cases where there are no family members, some states may allow a close friend to provide input, or they may assign a physician to represent what is in the best interest of the patient. Now, there are quite a few types of advanced care directives that can be put in place. I've listed a few here. The Do Not Resuscitate Orders, or DNR, is a legal document that instructs healthcare providers not to perform CPR on a patient if their heart stops beating or if they stop breathing. A healthcare power of attorney is a legal document where you designate someone to make medical decisions on your behalf if you happen to become incapacitated and are unable to make them on yourself. This definition could also describe a healthcare proxy. Instruction directives and living wills document a person's wishes regarding medical treatment in the event that they are unable to make decisions themselves. These usually cover preferences on life-sustaining treatment, organ donation, and pain management. Medical orders for life-sustaining treatment are intended for patients with serious health conditions. These directives let them plan on what life-sustaining treatment they would or would not like to receive. The Psychiatric Advance Directive is a legal document regarding a person's treatment preferences for mental health care. This can include treatment options, preferred facilities, and emergency interventions. So now that we've discussed what documents could be discussed during advanced care planning, let's move on to the coverage. Advanced care planning is a voluntary face-to-face conversation that a physician or other qualified healthcare professional has with a patient, their family, or a caregiver. Discussions should include the patient's healthcare wishes, if there comes a time when they are not able to communicate or make decisions on their own. These discussions may include options in advanced care directives. So They may be explained to the patient at that time. It may include help completing forms. These forms can usually be found on the state attorney general's website. So if a provider would need those ahead of time, that would be a place where you might be able to find them. Services can be provided during the annual wellness visit or during a medically necessary Part B visit. Now, in order to report advanced care planning services, healthcare providers must follow CPT rules regarding minimum time requirements. Advanced care planning should be the only topic of discussion during the time being billed. While there is no limit to the number of times that advanced care planning can be billed, the patient's records should document what was changed, what warranted billing for the service again. So this could be related to the patient's condition, or maybe they changed their mind in regard to end-of-life care that they wanted to receive. The Federal Code of Regulations does provide some requirements for providers. I have added a link to that slide in case there's somebody who would like to read those. Next, we're going to discuss how to bill your claims to Medicare. Now, the first 30 minutes would be billed using code 99497. Additional 30 minutes would be reported with code 99498. The code 99498 should be listed on a separate line in addition to the 99497. We are going to go over some examples of this in just a moment. Now, there is no diagnosis requirements, so you're going to want to use a code that explains the reason for the patient's visit. And that's because sometimes it could, they could be in their annual wellness visit, or they could be there for another visit. So you're just going to want to use a code that explains the reason they're there. If the service is being reported as part of the patient's annual wellness visit, then deductible and coinsurance will be waived. The exception to this rule would be if the annual wellness visit were denied for frequency. In that case, the deductible and coinsurance would apply. Charges would also apply if the advanced care planning is received outside of that annual wellness visit. So CMS has provided some examples for billing, so I did want to share those with you. Any conversations that last less than 15 minutes should not be billed using an advanced care planning code. You may need to see if the requirements are met in order to bill a different evaluation and management visit, but you should not use the advanced care planning codes. Now, discussions that last 16 to 45 minutes would be billed with code 99497 and 1 unit. Conversations that are 46 to 75 minutes would be billed with 1 unit for code 99497 and 1 unit for code 99498. If the conversation lasted 76 to 105 minutes, then the claim would be submitted with code 99497 showing 1 unit and code 99498 showing 2 units. This information was found in one of the resources I provided. So if that's something that you want to reference back to, it will be there also. So if advanced care planning, it is a component of the annual wellness visit, and it is separately billable. In this situation, it's treated as a preventive service. So if it is during the annual wellness visit, the services would need to be received on the same day and by the same provider in order for the deductible and the coinsurance to be waived. It should be submitted on the same claim as the annual wellness visit, and it would need to be billed with modifier 33. Now, those providing these services will want to make sure that they include the following elements in their documentation. Records should show that the conversation was voluntary. You're going to want to talk, you're going to want to have what advanced care directives were discussed. Were there forms filled out? Who was present during this discussion? So was the patient alone? Did they bring a family member or a caregiver? Now, documenting the time spent having the face-to-face conversation is going to be very important in order to choose the correct code and the units. And I know that a lot of you that are here today don't have control over that, but it should be reflected in the documentation in order to bill correctly. We will talk a little bit later. That is one of the errors that the Office of Inspector General and the CERT reviews are finding is that the time requirements is what lacks the most in these situations. If there is a change in the patient's healthcare status that initiated the discussion or caused the topic to be revisited, that should be documented. Any decisions that were made regarding the patient's healthcare wishes should be added to their medical records. Now we're going to go under resources, and I really want to spend some time on this because I think it's going to help you bill correctly and know what you need to have in order for those documentation requirements. Now, I have provided links to the CMS only manuals which discuss advanced care planning. I will tell you that the information that you are going to find there is only going to pertain to advanced care planning that is provided as part of the annual wellness visit. So all three of those, it all pertains to the annual wellness visit and billing for that advanced care planning separately. The Advanced Care Planning MLN fact sheet provides a lot of good information. I went out there and checked this morning, and unfortunately CMS has taken that down at the moment. So I'm assuming that they're making some changes to that, and I'm hoping that it'll be put back up quickly. But that is something that had a lot of information that you'll definitely want to continue to try to check out. Hopefully they'll get that back up soon. The Advanced Care Planning Bill Correctly for Services Compliance Fast Facts. I do want to take you out there to look at that. That is the OIG report that I was talking about earlier. Real quick, we're going to go over here. I did notice that there was an error in the first resource. That should be Code of Medical Ethics and not Medicare Ethics. I did include that just because it provided some guidance for those who are performing the advanced care planning conversation. I also included a link to the State Attorney's General search, since some states have advanced care directive forms available on their website. The Area Agencies on Aging search was included as it can provide providers and beneficiaries with local agencies that can help them fill out those advanced care directives. So let me go back here and click on this. Okay, so first I want to click on, this was a recent report from the Office of Inspector General, so I do want to click on that. Sorry, it was on there earlier. I'm going to scroll down just a little bit here because I did want to cover a little bit of this information. I'm sorry if my scrolling bothers anybody. Right here. So what the report for the OIG found was that out of 691 reviews, 225 met federal requirements while 466 did not. They found that the reason for this was because providers don't understand the federal requirements. And I know that we can all agree that federal requirements aren't always easy to understand. So that really didn't surprise me when I read it. The OIG did go back to CMS and they suggested that they provide education on documentation, time requirements, and that they address when multiple advanced care planning services are appropriate. I'm going to scroll down a little bit here. Again, sorry, this bothers with the scrolling, but I want to take you down. Okay, so what the OIG found, they went straight to the American Medical Association code book, the CPT code book. And this is where they started talking about the time limits. It does state that the provider must have at least 16 minutes of face-to-face time with the patient discussing advanced care planning in order to bill for those. 15 minutes or less are not billed as an ACP service. Just going to scroll down a little more. Here, they gave the chart as to when they should be billed, the coding for it. That is where CMS found their requirements, and that's what I included in my slide presentation. Now, according to the CMS does have a frequently asked questions document, which is included here. I do want to point out that this was from 2016, but there is a lot of information in it that does still apply. I'm sorry. So they did take a lot of the information from that 2016 FAQ and they put it in the new resource. So I do think that it's worth spending some time on it. I do have it pulled up here. They do ask about the time basing. A lot of questions that I got from the pre-submitted questions were regarding documentation. They do have what settings can the services be provided in. There is no place of service limitations to these ACP codes. They can be provided in a variety of settings. Again, you're just going to want to notate those. Who can perform ACP services? I did provide that information on one of my slides, but it would also be listed here. We already stated that the services should be voluntary, so we won't talk about that. What must be documented for the service? So it does say that you should consult your Medicare administrative contractors. I will show you what's available on our website, but it does have examples of appropriate documentation, would include an account of the discussion with the beneficiary, regarding the voluntary nature of the encounter, documentation indicating the explanation of advanced care directives. It also states about completing the forms, who was present, and the time spent. We went over the diagnosis code and that there is some additional information here that you might find helpful. If we go to the WPS website, I just did a search for advanced care planning. We do have tips for Medicare. Here, the advanced care planning fact sheet, that is the one that I was going to talk about a little today, but that was taken down this morning. So again, yes, go ahead, Tom.
You may want to go ahead and select that. I just verified and it looks like it's back on the website. So just FYI for you. Oh, of course not. I'll put a link in the chat to the one that I found that just came up. It's a different link than what that is. So I think that may be
great. Thank you so much. let's see. Just going to see if I could get into, no. I apologize, everyone, that I can't get out to that. But like Tom did include that in the chat, so that does provide a lot of information that is CMS's latest. Our website also does talk about the CERT reviews that were done. If anybody is not familiar with CERT, they are the Comprehensive Error Rate Testing Contractor. So they select claims, they do reviews, and they try to help find ways to reduce those errors. You can see here from the post-payment reviews, there was a lot of missing documentation, especially documentation that supported the time that was spent discussing advanced care planning. And again, there is a lot of information that goes back and forth with the OIG. Their recommendations to CMS, they do list CMS's responses to them. There is information here. We had talked about this being billed multiple times. So CMS does expect documentation on what changed with the beneficiary's health status or their wishes or both. So that would be another thing you'd want to make sure you documented if that is being billed more often. I'm going to go back to the presentation here. Now, there are a couple other pre-submitted questions that I would like to cover at this time before I ask Tom if anything's been put in the comments. I have a question that asked about evaluation and management being billed with advanced care planning and what documentation is considered double dipping. CMS is very clear that if you are going to bill for advanced care planning, then that should be the only topic of discussion. So if there were other things that were covered, that's not going to be included in the time that you're counting for that advanced care planning. That would need to be documented towards something else. Can outside companies offer the advanced care planning and bill for it? So I'm personally not sure what type of companies would be providing these services, but an entity would need to be enrolled in the Medicare program, and they would have to be issued a National Provider Identifier or an MPI number in order to bill Medicare for any services. Next question would be, can I separately bill ACP 99497 with a Welcome to Medicare G0402 annual wellness visit, or is that bundled? So yes, advanced care planning can be billed with the annual wellness visit. You would need to make sure that the requirements for the codes are met, and you would bill as instructed on slide 20. Next question was, can ACP services be provided via telephone only in 2025? I did find that advanced care planning is on the list of telehealth services for 2025, but I cannot find anything stating that there is a limitation regarding audio only services. So it can be provided via the telehealth list. I am going to stop now and go over to Tom and ask what has come through in the chat.
All right, so first question. Can elements be performed by other clinical staff under the team-based care and then billed under the physician?
I did provide a list of the other this service can be provided by a physician or a qualified healthcare professional. And what they specifically listed was a nurse practitioner, a physician's assistant, or a clinical nurse specialist.
All right, next question. How does ACP time codes work with RHC billing? Do providers get reimbursed for this service? I'm going to assume they're talking about their air, their all-inclusive rate.
I am too. If you could send that question into, if you could send that to our team mailbox, I can look further into that. I didn't find anything when preparing this. I didn't find anything separately related to rural health clinics, so I don't want to answer that
So,
without giving some
sorry,
information.
Karen.
Oh, Tom, go ahead.
Just FYI, if it's done as a component of, and I think it's the annual wellness visit or is it the IPPE, which one of those, it's a component of that service. That service is included in your air. It's part of the all-inclusive rate. So if the ACP is done as part of that service, then I know that that would also then be included in as a freestanding standalone. I don't know anywhere that it says that it is part of your air. So what I would have to look at is, one, what services are you doing in conjunction with that day? Because that will make a direct factor in whether or not it's included in the air.
Yes, thank you for that additional information, Tom.
Next question, does consent need to be documented before providing ACP services?
Yes, you would want to document consent.
All right. Next question. If APP discusses ACP with the patient today, but after discussion wants to discuss again with the family members the following day in patient hospital, can you bill for ACP today and an ACP tomorrow?
Again, it can't, there is no limit to the number of times it can be billed. It's just that the physician or whoever is providing the service is going to want to document why it's being billed again, why they're revisiting this. So I can't really say yes or no, it's going to be paid or it's not going to be paid. There's no limitation on how many times it can be billed. It just has to be documented why it is being billed.
All right. Next question is actually a comment about the two web addresses that I posted, and if they're receiving errors on those, what's happening is it looks like they're taking it up and down because like sometimes I'm getting it and sometimes I'm not. So my guess is something is going on with because those are Medicare Learning Network areas. They're the CMS website. So if CMS is updating something from those two, I may be able to select it this moment, but then like in 3 seconds, it's not available. It just depends on what they're doing with it. So keep track of them. Maybe you want to check it out later. Maybe what we'll do is we'll have Karen kind of show you, Karen, if you don't mind, could you show them how to navigate to cms.gov and then to the Medicare Learning Network area where they would find this so that in the future they could look for it if they needed it. That might be the easiest way to do that because
Yes,
it's
you were
really
reading my mind.
kind of crazy there. Yeah.
Okay, so if we go out to cms.gov, here's the homepage here. You'll see up here where it says training and education. So we're going to click on this. We'll go down to the Medicare Learning Network, and then you can click on resources and training. Now here, this top link here, the publications and multimedia, if we click on this, here is all of the publications that CMS has put out. It does have different formats. I actually did a webinar on this yesterday that we went over some of these. So if I do up here and do advanced care planning, oops, you can see here is the advanced care planning with the fact sheet. It'll take you here. Here's where you can download it. No, Here we go. It's going to come up. So here is the MLN fact sheet that CMS has. We'll kind of look at, since it's up right now, we can go ahead and look at it really quick. It explains the advanced care planning. Here it lists the documentation requirements that we kind of talked about. It talks about coding. Here's the information about it being time-based, that you can't bill for it if it's under 15 minutes. So I'm sorry, Tom, the question was just about this coming up or not. I just want to verify that.
Yeah, the question was that as they're clicking or using the links that I actually put in there, they were getting errors, which again happens back and forth. So if you guys follow Karen's instructions on how to get there, just keep checking it back. You can copy the links that I gave you. That's fine too. Yeah, I don't know what to tell you other than that it's been really inconsistent today. So maybe they're doing something with it. Who knows?
Yeah. I'm glad it came up though, so you guys can at least see what it looks like and what information is included in there. As you can see, it does provide a lot of links, so there would be additional information that you could find. Do we have any more questions, Tom?
Couple more. Can insurance companies provide ACP services?
That would probably be up to the insurance company. I mean, they're private insurance companies, so that would really have nothing to do with Medicare coverage for that.
And Medicare would not reimburse that insurance company should they do that. So whether or not they do or not, it would be the same thing for a Medicare Advantage plan. That's up to the individual plan to decide. So next, if palliative care providers that use ACP along with office visit E&Ms and also hospital settings, and they gave the codes that go with that, they've been adding a modifier 25 and to the 99497 and getting denials and being told they need to do an appeal. Is this true?
I am not aware of that. That would be something that customer service would be able to look at the actual claims that were being billed and what they denied for. Since I don't have any claim information, I don't know what they denied for, or I don't know how they processed. It's really hard for me to answer that question, but I specifically have not heard of that occurring. I don't know, Tom, if you have any additional information on that.
Can you go to our website for me, please? Can you navigate there for a second and pull up the modifier 25 fact sheet? I do not believe a 99497 fits the evaluation and management use code for 25, but I could be wrong. And that's why I want to make sure. Oops, where'd it go? Okay, let's see. So this is an E&M service, an ACP. Keep just scrolling down a little bit more. I wanted to see what it had out here. Yeah, there's no locations. So it does fit that. Is that correct? 497. So it would fit into this, and so it could be. No, I don't know why they would be denying it. Again, Karen doesn't know that either, but I'm not sure if you're trying to say it's a separate evaluation and management service, but keep in mind, if it meets the definition of an evaluation and management service, CMS does only allow one evaluation and management service, and then you could potentially code that higher if this is truly being used with an evaluation and management service. The rationale for that might be that it really is part of that E&M service and should just be coded higher. The reason that they're asking you to do an appeal is they want to see the documentation that comes with that versus just auto paying it. This is normally done as a fraud abuse prevention type edit to say, hey, this is what's going on with it. So Karen and I don't have that information. And again, we can't claim specifically look at it. Those are some speculative thoughts that I have as to why this could be happening. So without that information, again, go to customer service with your claim numbers, put the claim numbers in and have them look at them, and they should be able to answer that more. Again, if they're just simply telling you you need to file an appeal, that there's some stuff going on underneath, and it might be that that's the way that we're denying it, to have that documentation reviewed to make sure that it really is two separate components. So yeah, just to let you know.
Yes, thank you for that additional information, Tom.
So let's see. The last, it's more of a comment, but the 2016 Q&A regarding who can perform ACP services states team-based approach. Please review.
This was the document that they said, right, Tom?
They just said the
Thank you.
2016 Q&A. So maybe just put team in there and see if it comes up. It's got a hyphen in it. That's why.
Um, I can go back and I can take that back. Remember, this was published in 2016, so there could have been changes made to this. But I can take that book back and look further into that.
That is the last question that we do have right now in the chat.
Okay. All right. Let's go back. Sorry, I have to get back to where I was before. So after the close of today's webinar, you are going to receive a thank you for attending email. Here is where you're going to find proof of your attendance and contact hours for continuing education units. This email also contains a link which will give you the opportunity to provide feedback. Now, if you don't get this email, please check your spam or junk folder. You'll also need to add messenger@webex.com to your safe sender list, and this will avoid you having any issues in the future. Now, if you joined only by phone, you will not receive this email. So please send an email to the education mailbox and include your name and the phone number that you used to join. That way we can verify that you attended and we can send you an email certificate. Now, if you do think of any questions after the webinar, you do have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line so that staff will know that your question is related to this webinar and they will send it directly to me. Now, remember, if you do have a question that is claim specific, those should go to customer service. When you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Tom add a link into the chat. Your feedback does mean a lot to us. We review what you have to say and we do our best to make the changes that you ask for. This is also an opportunity for you to let us know what topics you would like to see us provide education on in the future. So if there's something you really want to know about, please be specific and put that in there. Also, if you have ideas that you think would improve how you receive your education, be sure to tell us. We're always open to new ideas and things that you would like to see us do. The redirect does look like what you see here in the middle. We don't have any control over how this appears, so we do want to show it to you so that you don't think it's spam or anything malicious. It is the CMS Qualtrics survey website. Well, that brings us to the end of today's presentation. On behalf of myself, Tom, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.